Yes. Yesterday classes, our previous class, we can see about the anti-epileptic drugs and anti-convulsant drugs. Okay, today we can deal about that is called drugs acting on the nervous system. The main topic that is called analgesics. Very important for 10 marks question. What the question asked is define analgesics, classify analgesics, and explain about the morphine in detail. That is comes under this opioid analgesics. I will say first. What do you mean by analgesics? In analgesics, it is defined as the drugs which is used to treat selectively to reduce the pain by acting on central nervous system and peripheral pain mechanism without altering the consciousness of person. That is called analgesics. It mainly reduces the pain by acting on the CNS and peripheral pain mechanisms without altering the consciousness of person is called analgesics. Okay, the main point to stress here that is called reduces the pain and CNS and peripheral pain mechanisms without altering the consciousness of person is the main stress points of this analgesic. Next, the main classification of analgesics. See, this is the main classification of analgesics. The analgesics is classified into opioid analgesics and NSAIDs, that is called non-steroidal anti-inflammatory drugs. That is non-steroid. There is no containing of any steroid, non-steroidal anti-inflammatory drug. And this opioid analgesics. In this opioid analgesics is also known as narcotic analgesics. Also known as narcotic analgesics. In this opioid analgesics, which is a derivative form of papaver somniferum. Papaver somniferum. Based on this plant, they have to derive this opioid analgesics. Okay, next. In this opioid analgesics is also known as narcotic analgesics. This narcotic analgesics or opioid analgesics is classified into three main types. First one is opioid agonist, opioid antagonist. See, the difference between agonist and antagonist is the two main classification, and third one is called partial mu receptor agonist. See, why the mu receptor means here the mainly this analgesic drugs which is acting on the mainly acting on the cellular level. I will tell the morphine mechanism of action. This is the third classification. Next, this opioid agonist, there is under this classified three. First one is the natural opium alkaloids, semi-synthetic opiates, and synthetic opioids. Opioids or opiates, both are same. In this natural opium alkaloids, example very important, that is called as morphine, then codeine, nascapine, and divine. These are the main four examples comes under this natural opium alkaloids. And then semi-synthetic opiates, here heroin, one of the main drug, then hydromorphone and oxymorphone. These are comes under in semi-synthetic opiates. And then synthetic opioids. In this synthetic opioids, example pethidine. It is one of the very important analgesic, and tramadol. This is also very important. This main active comes under this synthetic opioids. It is tramadol which is mostly used in the hospital side sectors to reduce the pain in surgical and gynecology, obesity. That is in tramadol. Very important. This is about 100 mg. Okay. It comes under synthetic opioids of opioid analgesics. And then this is all about this opioid agonist. Then opioid antagonist. Example pentazocine, 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 and nargofine and butophenol. These are three examples comes under this opioid antagonist. Then partial mu receptor agonist, that is called buprenorphine. This buprenorphine is the main analgesic effect which is used during the spinal anesthesia. By using this bupivacaine, already we can discuss, that is called analgesic anesthesia. Along with that bupivacaine, they have used this buprenorphine to sedate for analgesic. This is called buprenorphine. This is the main classification of this opioid analgesics only. In this, after the classification of this opioid analgesics, they ask related to only morphine. Okay, or otherwise they are explained that any one of opioid analgesics. So we can take example of this morphine. This is very important drug related to the clinical side. So that's why we have to take this morphine is an example of this opioid analgesic, opioid agonist. In NSAIDs we can see in next class, that is called non-steroidal anti-inflammatory drug. Its own classification will be there. Okay, that is considered as salicylates. Okay, that's related to the NSAIDs. First we are today discuss about related to this morphine. It is one of the natural alkaloid, natural opioid agonist, or natural opioid agonist. Yes, this is first natural opioid agonist, derivative from the papaver somniferum, natural alkaloid. This comes under the morphine. Okay, and also it is one of the what it is opioid analgesics. This is also one of the comes under opioid analgesics. OA. This is about this morphine. Yes, main point he has come to here, that is called as the mechanism of action. The mechanism of action of morphine. Mechanism of action of morphine or analgesics. How it has to be action in that when we have to take the drug. First, what happens here, when the analgesic, this morphine we have to injectable into the body, what happens? It will reduces the transmission of nociceptive impulses. Okay, it will reduces the transmission of nociceptive impulses. How this morphine acts at a cellular level. Acts at cellular level by activating the receptors. By activating the receptors such as K receptor, delta receptor and mu receptor. These are the receptors. And then what happens after that? These receptors present in the all over the CNS. Okay, receptors are present all over CNS. What happens? It will reduces neuronal excitability, and results in reduces the transmission of nociceptive impulses. See how? See, first when we inject this morphine is to be injectable, what happens? This acts at a cellular level by activating the receptors. Such as K receptor, delta receptor and mu receptor. These three receptors which is present all over the CNS of the brain, that is called central nervous system. Which these three receptors, when it has to be administered, it acting at the cellular level, by activating the receptors which is present in the all over CNS. Okay, when it go to the binds with that these receptors, what happens? This receptors is present in CNS. After that, what happens? It will reduces the neuronal excitability. This morphine will go and bind to that receptors which is present in the all over CNS. What happens? There reduces the neuronal excitability, which results in there is reduces the transmission of nociceptive pain impulses. That is comes. Then after that, there is an analgesic property. This is the main mechanism of action of morphine or analgesics. Mainly it focuses on, it will reduces the transmission of nociceptive impulses by activating the receptors which is present in the all over CNS. After that, it will reduce the neuronal excitability. This is complete mechanism of this opioid analgesics, not non-steroidal anti-inflammatory drugs. And then after mechanism of action, we move on to the pharmacokinetics. Pharmacokinetics of morphine or analgesics. First one is, we know that already absorption. Then distribution, metabolism, and then excretion. This is very important of this pharmacokinetic. Movement of the drug all throughout the body, it is absorbed by through the, when it is injectable form. When it is taken orally or injectable IV form, it has to be absorbed in the stomach and small intestine. Then it is distributed throughout the body, through the tissue, and also crosses the barriers. That may be placental barrier or it may be blood-brain barrier. These are the two barriers. And then metabolism in the liver, excreted through the kidney. This is the main pharmacokinetics of this analgesics. Okay, next, very important, that is called pharmacological action. Pharmacological action of morphine. See, in pharmacological action of morphine, it has to be acted on this CVS, CNS, cardiovascular system, central nervous system, GIT system, along with the smooth muscles, and acts as a histamine liberators. First one is that is called as CNS. In CNS, there is a minimum 8 actions. First one is act as an analgesics first, then euphoria, EUPHORA, then sedatives and hypnotics, sedatives and hypnosis, and then respiratory depression. Okay, then nausea and vomiting. The action will be broad, nausea and vomiting, and then meiosis. After that meiosis, varus. Okay, and very important, that is called hypothermia. See, these are the mechanism, the pharmacological action of morphine on the central nervous system. Understand? First one is what happened, it has to be analgesic effect. It has what? Analgesic effect. First, in analgesics, what means? It has to be reduces the non-pricking pain. Non-pricking pain without altering the consciousness. That is first one acted, analgesics. It reduces the non-pricking pain along with the slight injuries and related to the illnesses. It has to be reduced, but without altering the conscious level of a person. That is comes under analgesics, comes in the CNS. And then what is hypothermia? In this hypothermia, this morphine or analgesics which go into the brain, what happens here? It will act on the this temperature regulating system. Temperature regulating system, TRS. It will go and act on this system, and it will lead to the what? Reduces called hypothermia, means there is a decreasing in the what? The body temperature. That leads to hypothermia. Decreasing the body temperature and leads to hypothermia. That is in hypothermia. That's how it acts. And then euphoria. Euphoria means it is feeling of well-being. And this euphoria, this is one of the we can see in this mood disorders, in psychiatric conditions. We can see in the further classes when we are studying psychiatry. That is called euphoria, feeling of well-being. Feeling of well-being means it has to be this analgesics morphine also reduces anxiety, apprehension state, and along with the fear. Anxiety, fear, and stress, and apprehension. APP, apprehension. This is comes under the euphoria. Next, sedatives and hypnotics. These analgesics which cause some drowsiness. drowsiness, that is sedation hypnosis. And then respiratory depression, it acts on directly on the medulla oblongata of the, which is present in our brain. It will suppresses the respiratory water, the breaths of the person, that is called respiratory depression. And then nausea vomiting, in nausea vomiting, that is called one of the main point here, CTZ, means chemoreceptor trigger zone, which is present in the medulla oblongata. This morphine go directly act to this zone, that is called chemoreceptor trigger zone. It will induces the nausea and vomiting of the person who have take this drug. Okay, that's why the morphine is also having the adverse drug reaction. And then meiosis, what happened, this opioid analgesics, this will constriction of the pupils. Meiosis means constriction of pupils, constriction of pupils by stimulating of the third cranial nerve, by stimulating the third cranial nerve. By taking this analgesic, opioid analgesics, what happens, there will be stimulating of third cranial nerve. First one is olfactory, second one is optic, and third one is oculomotor. The function of oculomotor is constriction and relaxation of the pupils. So by activating this small opioid analgesics, what happens, it will stimulating the third cranial nerve, it will cause us indirectly the constriction of the pupils, that is called meiosis. And then vagus, this is 10th cranial nerve, vagus nerve, 10th cranial nerve. They are acting on this 10th cranial nerve, which causes bradycardia. These are the main actions which is comes under this CNS. Analgesics, hypothermia, euphoria, sedation, hypnosis, respiratory depression, nausea, vomiting, meiosis, and vagus. And next, second function, that is CVS, cardiovascular system. In cardiovascular system, this morphine directly acting on the vasomotor center, VMC. Vasomotor centers causes vasodilation. Vasodilation leads to hypotension and bradycardia. Okay, it will go and act on this vasomotor center, leads to the vasodilation, acting on the vasomotor center which is present on our brain, and this causes the vasodilation, and that leads to the hypotension. This acting on the CVS system. And then third one is GI system. In GI system, it will, what happens, very important in GI system, it will go and acting on the where means, that is called GI smooth muscles. Okay, GI smooth muscles, peristalsis, reduced peristalsis and constipation. This is comes under GI. And then that is biliary tract. In this biliary tract, what happens, there will be a increasing the tone. There GAT, there is a decreasing the tone of the GI smooth muscle, acting on the GI smooth muscle. There is a reduces the tone of GI smooth muscles, and it will lead to decreasing the peristalsis and leads to constipation. But in this biliary tract, what happens, how this analgesic effect is acting on this biliary tract, there will be increasing the tone of a small variation, increasing the tone of sphincter of Oddi. Sphincter of Oddi. There will be increasing the tone of this sphincter of Oddi, that leads to increasing the intrabiliary pressure. Increasing the intrabiliary pressure. This is the main action on this biliary tract. And then urinary bladder. Urinary bladder, what happens, there is a decrease in urinary output. How this will act on the external urethral sphincter, increasing the tone of external urethral sphincter, leads to the high. What happens here, there is a urinary retention. Okay, this is the main which is act on the urinary bladder. And then final, that is called as histamine liberator. Here what happens, this what analgesic morphine, opioid analgesics, what happens? It will releases some what skin rashes and urticaria. That is called histamine liberator. Skin rashes and urticaria. These are the histamine liberators. Then this urinary bladder, increasing the tone of this external urethral sphincter, not internal. That leads to the urinary retention. This is main pharmacological action of this opioid analgesics. Example, morphine. And next, final, that is called therapeutic uses. Therapeutic uses. First one is analgesics. First therapeutic is analgesics. Next, pre-anesthesia. Pre-anesthesia. Why? Then surgical analgesia. See, in analgesia you have to explain very well about here. See, why pre-anesthesia? Already we see that the one of the example that is called as a mu receptor blocker, partial mu receptor blocker. Example, bunorphiprine. That is usually as a pre-anesthesia agent during the bupivacaine injection of the spinal anesthesia. So that's why it is pre-analgesia. Anesthesia. Surgical anesthesia, why? In surgical anesthesia, as the example, tramadol we can give. After the surgery, we can give the tramadol to relieve the more severe pricking and non-pricking pain. That's why this surgical anesthesia. And then acute left ventricular failure. Next, acute left ventricular failure. Person was suspecting from the more pain related to the acute left ventricular failure. That's why we administer the analgesics. And along with it will act on this chemoreceptor trigger zone. So that's why we have to use this analgesic to reduce some such of coughings and cough and along with the diarrhea. Example, I have already said that this is called loperamide. That is also comes under this opioid analgesics. In classification, I will tell that is also one of the that is called diarrhea. One of the indications for this therapeutic uses for this analgesics. Okay, and then final that is called as side effects. Side effects we have already seen, that is called nausea and vomiting, hypersensitivity rashes, respiratory depression. Okay, and then bradycardia, severe vomiting, reduced hypothermia, that is called as reduced body temperature, hypothermia, drug dependency, and addiction. Heroin is one of the main drug to addict, that is called addiction. And then fall in BP, that is called hypotension. These are the main side effects which are administered this analgesics, that is opioid analgesics. Nausea and vomiting, that will be severe due to stimulation of chemoreceptor trigger zone, hypersensitivity rashes, that is called histamine liberator of this one of the action of morphine or opioid analgesics. Respiratory depression, which is acting on the medulla oblongata. Bradycardia due to act on the cardiovascular system of vasomotor center. Then hypothermia due to the temperature regulating system. Drug dependency and addiction of that heroin. Okay, and then finally that is called hypotension due to vasodilation. Okay, this is all about side effects. So today we discuss about analgesics. What do you mean by analgesics? Selectively reduces the pain by acting on the CNS and this what without altering the conscious level. That is called analgesics. After that we have to see that what is the classification of analgesics. Classification of analgesics. Opioid only we can discuss today, that is called opioid analgesics. Tomorrow this is NSAID deal. Okay, opioid analgesics entire classification. Why diarrhea? See, this is pethidine, tramadol, this loperamide. Okay, it comes under where? Comes under this synthetic opioids. Synthetic opioids of opioid analgesics comes under here. Synthetic opioid and tramadol. This is due to what? Surgical anesthesia, surgical analgesia, and dopamine due to diarrhea. Okay, comes under opioid analgesics. Then this is entire classification of this opioid analgesics only. And then main we can, that is called pharmacology of morphine anta bandaga. So here what happens, this papivarus somniferum and this narcotic analgesics are opioid analgesics. Two lines you have to write about that. And then after that, very important, that is called as mechanism of action. Mechanism of action, acting at a cellular level by activating the receptors which is present in all over CNS. After that, that will be reduces the pain, what reduces neural stability, and indirectly that will results in the reduction of the nociceptive pain impulses. That is mechanism of action. Pharmacological action of this morphine or opioid analgesics acting on the CNS. It's the entire detailed explanation. CVS and then biliary tract, CNS, CVS, GIT, biliary tract, urinary bladder, and histamine liberator. And then therapeutic uses. These are the major therapeutic uses of this analgesics. And then finally, after the therapy, and side effects. These are adverse, also known as adverse drug reactions. Adverse drug reactions are side effects, which is the these are noxious changes. Side effects means there is a noxious changes due to the susceptibility of drug of any one of opioid analgesics is called side effects or adverse drug reactions. Okay, this is about today's this entire classification of opioid analgesics only. Tomorrow we can deal with non-steroidal anti-inflammatory drugs. Along with we can say about their entire explanation of aspirin. This is one of comes under salicylates. Okay, thank you.